Recording has started.
Oh, great. Thank you, Erin. And then, if possible, I'd love to see video. I'm really enjoying seeing everyone's face. I think we've all had the opportunity to facilitate a Zoom, so it's so much nicer and more interactive if we can see people. And that way, I'm not just talking to myself and my dog in my house. So, thank you for that. And as we are letting people log on, if you could write in the chat as we're coming upon writing our goals for a 3-year aging plan. You'll all be writing a health promotion goal. So if you can put some ideas, one goal that you want to achieve, it could be in your next cycle of plan or something you want to do this year. We'll be talking about the aging unit plans in just a little bit. So feel free to write in the chat. And Erin, can you see the chat? For some reason, I'm not able to see it on mine.
Yes, I can see it.
Okay, great. And if anyone's writing in there, if Erin, if you want to read them off, that would be great.
So Heidi Russell says to have two individuals trained for healthy living with chronic pain. Um, Aging and Disability Resource Center, I'm not sure who that is, says to add 6 instructors to provide Tai Chi, strong bodies, and walk with ease. Heather Janes said to complete our scheduled Powerful Tools for Caregiver class in October in person. Wendy Hutter said, Mom. Lisa Conan, follow up with people who have fallen to connect with PT. Start a new health promotion workshop, says Carrie Dombrowski. And then Jody Olney says, getting more facilitators trained for stepping on pals and a few more. Love these programs.
That's wonderful. Thank you for writing all of that in the chat. That's going to be really helpful too for our later discussion. So please feel free to continue writing in the chat as well. So for our agenda today, you can see since we only do this quarterly, we have really a jam-packed agenda. And at the end, I'll also do a poll so people can say if they want to have the health promotion webinars more often or less often. I know that several of you attend also caregiving and nutrition, and it gets to be a lot if we're doing monthly calls. So try to make these as meaningful as possible to you all. So anytime you have an idea that you would like to have on the webinar, please send me an email and let me know. We definitely try to honor those. So we'll go ahead and get started. My name, for those of you I haven't met, is Angie Sullivan. I'm an OAA consultant for GWAR in the area of health promotion. I've been with GWAR a little over 3 years now, so really time goes pretty quick. So I do these webinars on a quarterly basis, as I said. So today, really busy. So we're going to start off with Carrie Kretz, who does our SAMS data entry for Title III programs. So we're going to talk specifically about some Title III-D errors that we've been seeing on a regular basis, and also maybe expand the way that you're able to use the SAMS database and maybe creating some rosters for programs where it makes the most sense. And then we have 2 programs to highlight. Usually we only highlight one, but these were so fantastic. We had to do 2. So stepping up your nutrition, we have our fabulous Pam Van Kampen from GWAR, who's going to be talking about that wonderful program to be used as a ground zero. And then we have Erin with a stand up from WEHA. Quite a few updates from GWAR, so I will be covering those, looking specifically at some new NCOA resources as well. And then our updates from WEHA. And hopefully we'll have some time at the end for questions and answers and some closing comments, but please feel free to use the chat throughout anytime you have a question. And if we're not able to get to those, if we don't have enough time, then we will certainly, I'll reach out and get to everyone individually. So at this time, I am going to welcome our Carrie Kretz from GWAR, and she's going to talk about some 3D SAMS reporting. So welcome, Carrie.
Hold on. Got to click all the right buttons. Hi. So I'm Carrie Kretz, and I work with GWAR, and I do all the data management overview, which includes for many of you that are aware of this, it would be your SAMS data entry for your Title III health promotion. And that would include, of course, your 23A, which is the evidence-based health promotion, and then also the 23B, non-evidence-based health promotion. One of the things that we have been talking about recently is also the notion of, as mentioned in Angie's slide here, is the notion of when you're not using Title III dollars, putting that data still in SAMS, and whether or not you need to, and then also how to utilize a roster for some of these ongoing classes and so forth. So the one thing about, if you are providing a program where basically 100% of the money is not coming from Title III or monies supporting Title III, so which would mean your fiscal person would not be reporting it on our GWAR form. So here again, we've been really encouraging a lot of management, SAMS users, and fiscal to be in coordination, to be discussing all this so that you're reporting it accurately in SAMS and your fiscal staff is also reporting it accurately. But in the event that you received a grant, let's just say for Stand Up, and it was 100%, nothing Title III related, you can still put it in SAMS. However, you would not report it as a Title III service. Instead, it would be reported as an NOAA service, which just stands for Non-Older Americans Act. And that basically means you are not using any Title III money for that service. Or we also use the NOAA for people who don't qualify for the Title III programs. So basically it means they are not over the age of 60. Because for all of our programs, when you're using Title III money, the person must be over the age of 60 to be receiving the service at a donation rate. But so you can still put it into SAMS. And as mentioned here, every 23A and 23B service must be using a subservice. So you cannot be just reporting that you did some high-level evidence-based programs. You have to tell us what was the program. And same thing too with the non-evidence-based, even if you're just doing a basic exercise or fitness class, you also need to be able to, or be stating that in SAMS. Fiscally, of course, they will only put it in on their form as it was just a 23B health promotion, non-evidence-based program. But then the services overall and the funding have to align. But the state has required that for any 23A and 23B services, there have to be subservices so that they can also assist in monitoring what programs are being offered utilizing the Title III funding. In addition to that, though, creating a roster. Rosters in SAMS are best used for ongoing classes. So for example, if you had a stepping on class, which I think typically runs 6 weeks, for a standard class, that wouldn't probably be as beneficial for a roster. Not that you couldn't do it, but part of the reason being is that it's not, once the 6 weeks is done, those same people don't typically, continue on. If you're doing another 6-week class, they're not going to be in that same class. Versus if you're doing like a standard exercise or yoga class that is always ongoing, maybe it happens every Thursday of every week, that's a more useful purpose of doing a roster. It's basically meant for a program or a service that is continuously ongoing, over an extended period of time, that you would be, the same people would probably be attending it over and over again. Because what rosters do is they go out and they find people who match a certain criteria, pull them into the roster, and then you're going to give them a continuing service as well as, as it gets served, they're saved. And then that person would kind of cycle back around and get pulled back in again. And it's kind of easy to think of, with health promotion, but one of our biggest programs, of course, that does use rosters on a regular basis is the meal program. So if you think about that, someone who got a meal last month is probably getting a meal this month, and so they continuously populate on that roster. But same thing with health promotion, you can very easily create a roster. So if you have an ongoing program, such as yoga or something like that, you can then have the system automatically go out and pull those people into the roster. You're going to give them another service of they attended our yoga class. Now next month, they're going to pull back into the roster again, and so forth and so on going forward. And I have my availability to share my screen, right, Angie? All right. So you all should be seeing my SAM screen now. Perfect. So I've set up a predefined roster here so that we could talk about it. Basically, when you go to add a new roster, it'll look like this. And this actually over here will be blank. But what I wanted to show you is basically the summary that you'll see with this. So when I set this up, and we'll pop back into the details so you can see it as well. But the one thing to think about, the way I like to describe a roster, if you draw an imaginary line above the word roster filters all the way across the screen here, and including this whole box actually, but if you draw an imaginary line, okay, like that, anything above that line is how the services are being saved in SAMS. So in this case, this is a Title III roster. So meaning people who are entered into this are only going to get a Title III service. You cannot have a roster that has multiple funding sources or care programs. So you couldn't have one roster that would be Title III and NOAA. And then the name of the roster is I just did health promotion exercise class. You call it whatever you like. The provider is Quasi because this is our test database. So technically that would be like Clark County Aging Office or however your provider name is in the system. We do base it off of a service delivery and off of a specific service. And as you can see here, over here is how I've saved the service. So anytime something gets entered into SAMS, this is how it's going to save it. It's going to save it as a 23B health promotion non-evidence-based activity with a subservice, and I'll pop this open, but with a subservice of exercise and fitness. Now you don't have to use any money. And as of this calendar year, we have been told we are not using any more fund identifiers. So you would not use the fund identifier box anymore either. Below this imaginary line, the roster filter section should pretty much always be blank, with the exception of the fact that you don't want to include inactive consumers and you don't want to include consumer groups. And then proceeding down from that is our service filter section. Now, this is how people are going to pull into this roster. So basically, and keep in mind, with your roster, part of the reason I don't have, and like I said, I'll open this up in a second, but part of the reason I don't have Quasi, which would be the provider, listed here is because the rosters are filtered, if you will, for security. So only your agency's clients will pull into this roster. And so if you've given somebody a service from another county or something like that, they could pull into this roster as well. But it's going to be only people that you are associated with in the SAMS database that would ever pull into a roster. Very similar to like your reports and stuff, which I think is one of our other training webinars coming up that Angie's going to put together with some reports and so forth. But in here, what I'm asking the roster to do is go out and find people who received a Title III 23B health promotion, non-evidence-based service with a subservice of exercise/fitness, and you'll notice with the number behind it. Please note that these have to be identical. There are other services out there. So technically there is another service out there just called Exercise. If you use that subservice over here, it won't pull in anybody. It has to have a number behind it. As of 2016, all of our services have numbers, and all of these subservices have numbers associated with them, so you know what subservice is associated with that service. The other thing that I've done here is I've used the day range feature and said, I want to pull in anybody who's received this service in the last 3 months. We typically don't recommend probably going less than the 3 months because this month, so if I were to try and pull up a roster to either print it off to send to a site, say where the exercise is going to happen, so you have a pre-printed roster and people can check in as they come in. If I was trying to do that, so for example, if I was going to do that right now for June is always going to be month 1. Right now with May, I probably haven't entered in any data. So that's month 2. And month 3 would actually be April. And hopefully I've entered in my April data. But so you could go back 4 months if you wanted to, or even farther if you want, but be careful because of course, the farther back you go, the more people that are going to be on this roster. And so with that, you may get, if you go back a whole year, you might get like, 50, 60 people on here. And then you're going to be complaining, oh, there's all these people on here that haven't, they haven't been a part of this program in almost a year. Okay, that's where you want to shorten that up a little bit, but not going any less than 3 months. But that's where you want to shorten it up a little bit. So it's the most current people that are on here. When I open this up, just to show you what the roster would look like initially, here's where I entered in the name. I did specific service under type, quasi, which is the overall agency. So for you, it would either be Age Advantage, Northern, Bay, or Southeastern. It's going to be the old AAAs, not GWAR. This is the care program. That's the funding source. The provider is you, and it's always based on a service delivery. As I mentioned, the only 2 things under roster filter would be not to include an inactive consumer or consumer groups. And then down under the service filters, you can use the care program / service. You can use the care program or the service service field separately, but I like using them together because it actually syncs up and tells you what care program and service are aligned together. The subservice, and as I mentioned here, just as a reminder, if I were to go look for, oops. So as I mentioned, here's an exercise / fitness class with no number behind it. Here's one that has the number 23 behind it, which we don't use anymore. And now you can see here's the one with the 23B. So make sure you are getting the correct subservice that matches the main services number. And then the day range. So we don't use the start date or end dates any longer, but then the day range. And so
Carrie?
at that point,
Carrie?
Yeah.
Sorry to interrupt, but we also have Pam has to go. She has to get off the call soon. And, I think this is great. I think this could be used with the Strong Bodies program that a lot of people are using where it's an ongoing. So, I think the major thing is we wanted people to know that this is an option within SAMS and to please use it. And Carrie's awesome and knows everything about SAMS. So you can just send her, she's got a wonderful signature line where you can actually just reserve a time on her calendar. So if you think that option is going to be good for you all, please reach out to Carrie with that. So as you can see, it can get pretty involved with how to create that. So
Yep.
so grateful.
And that was it. We've gone through it all.
Oh,
So
awesome.
I just wanted to show the more detail,
Okay.
but I was cutting off right then too. But yes, we have gone through it all. So that would be it.
Perfect. Thank you so much for that. I think this will be an ongoing discussion with SAMS because, when I look through the reports that Carrie sends, we're having a lot of great data input, but I know we're missing a lot as well. So this is just an ongoing learning opportunity for all of us. So right now we're having Pam pulling up her info on Stepping Up Your Nutrition, which some of you may have heard about this program, but we have a great opportunity happening actually next week. So we wanted to make sure we got Pam on and she could talk about this program. Pam, are you ready?
Yeah, I think I am. I just
Okay.
I was gonna like be on the thing. Can you see my screen?
We can see your screen. It's just not in presenter mode.
Okay, let me put it there. And then brief hold. Come on, little guy. I'm talking to the screen nicely. Okay. Now is
There.
it?
Yep. Now it looks great.
Okay. And how do I'm trying to find where I can like where you could actually see me. But I can't find that little button. Oh, there I am. Start video. Okay. Hi, everyone. Thank you for letting me join the call briefly today. I just wanted to tell you about Stepping Up Your Nutrition. And if you haven't heard of it yet, oh, wait, I got to do this. Enter. Let's get my, oh, wait, I got to do this on the screen. Scooch it over. Okay. If you haven't heard about this class, it's a one-time class. It's 2.5 hours. It's a perfect complement for your stepping on classes or really any of your evidence-based classes. It focuses on nutrition and specifically how nutrition can help prevent your falls risk. And the two nutrients that they really focus in on are protein and, let me shut my window, have all the street noise out there, are protein and fluids. And they use a validated screening tool called Screen2 that you can use for a pre and a post test. And we're still vetting out the details on how Wisconsin's going to use that and if that's exactly the tool that we're going to use. But I did want to mention that briefly. It's a free class. It's free to get trained right now. We have 30 slots available through the Wisconsin Association of Nutrition Directors that they've made available. And we have this incredible opportunity to attend a live virtual training next Thursday from noon to 2:30. And they're actually going to walk through the whole class so that you could see it modeled, so that you could see how to present the class. If you do the training online, it only walks you through a PowerPoint of why protein and hydration are important. It doesn't exactly walk you through the manual per se. So if there's any way that you could join this live training, that would be amazing. Like I said, we have 50 slots open for Wisconsin. It's first come, first serve, but we are going to give priority to those who have not been trained yet. We do have a few people who have been trained in Wisconsin online, but they have not had the opportunity to see the class actually modeled. So we're going to let them take the class too. And even if you are one of the people who has been trained already and taken the test and have your certificate, we're still going to ask you, if you join the call on the 27th, to take the test at the end of that call, just so they can count that towards their outcomes for that training. Okay, so a little bit more about the class. So wait, I'm so distracted by this thing. How do I move this? I'm just going to move that. Angie, you only see the PowerPoint, right? You don't see like what I'm seeing.
No, we just see the PowerPoint.
Okay, perfect. Okay, so participants will be able to understand the importance of balanced nutrition for falls prevention and identify the key factors that contribute to malnutrition. And like I said, specifically protein and hydration. The class is designed for anyone 50 plus. However, if they're between 50 and 60, that's a whole different reporting thing for SAM. So we're going to encourage you to offer it to people who are 60 plus. But I just wanted to let you know that because it could be a nice class to offer for your caregivers as well. Okay, let me go down here really quick. You can do the class one-on-one. So if you have somebody that you want to work with one-on-one, you can do that. We have some dietitians that are planning on using it for some people who are identified to be at risk. So you can do the class virtually, you can do the class in person. If you have tablets, you can load the class onto a tablet, and people can walk through the class with you that way. So if you're interested in that option, let us know. Angie's going to send out a follow-up email after the call today. It will include this little handout that talks about what the leader training is. So I'm not going to go over that, but I wanted to let you know that will be in your mailbox. And like these are the creators of the program. It came from Maryland Department of Aging in collaboration with the MAC, Maintaining Active Senior Citizens, an area agency on aging out of Maryland. And this is the agenda for the 2.5-hour class. Like I said, it's a one-time class. They talk about nutrition, how it affects falls, muscle matters, and they have some really nice graphics that help demonstrate, like this could still be the size of your leg, but your muscle inside of it can look like this compared to this. They've really focused on protein and fluid. Then they have a little break. And if you're doing it in person, the break is when you should be offering a protein snack. And it's a great opportunity to feature some protein items that people usually wouldn't think of. So maybe like hummus or beans. My husband works for Bush Beans, so I have to pepper that in. Or if you have a certain population that you're working with culturally that doesn't eat meat, you maybe really want to focus on the non-meat sources of protein. So that's the kind of fun part about offering it in person. And if you're doing it online, we have a list of snacks, protein snacks, that you could share with folks before the class, and they could share a protein snack with you virtually. And then you go through action planning. So the class is set up just exactly like any other evidence-based class, like Living Well with Chronic Conditions. It's scripted out. It has a script for you to follow. There's charts for you to make and follow. I already have all the virtual charts done in a PowerPoint for you to use if you're going to do the class virtually. And of course, we have a detailed leader training checklist that, again, Angie will send out for you. And if you're familiar with Aging Mastery Program and how you register via WUFU for that and notify Angie about your intent to offer the class, it's similar to that. This, I know it's hard to read, but at least you can kind of see where there's leaders trained so far. We would love to have leaders in all parts of the state. And then what we're going to do is kind of like group you guys together because there is an opportunity, if you want, and we decide to do this, to do a hand grip strength using this tool called a dynamometer, which is just fun to say. Y'all say it with me, dynamometer. That will be your new word of the day. But it's an objective way that if you do a session 0 and you use this dynamometer, you can measure hand grip strength. And then if you did a stepping on class for 7 weeks and you measured their dynamometer reading again at the end of that class, you'd really have an objective way to show them and to prove to whoever, us and other funders, that the class is truly making a difference. So that's something that we're going to continue to discuss to see if that is something that we're going to bring to Wisconsin. But there is an online training on how to use a dynamometer. So if you're interested in that, happy to talk more about that. And that's where we have a Stepping Up Your Nutrition Leader folder. And again, Angie, feel free to share this presentation so people can see what's in that folder. And then this is something we added unique for Wisconsin, is a malnutrition story form. Because after you go through the training, your eyes will really be open to, wow, all those things can contribute to malnutrition, or those are that could be malnutrition. And if something resonates with you and or with a participant in your class, we would invite them to fill out this malnutrition story form. And it's just for Wisconsin, but it's a great way for us to collect those stories that we can use in advocacy and in other ways. And then here's our rollout. We just started training our leaders this spring. We're bringing it to you all now because it's hopefully a natural fit for you. So we'll have another leaders Stepping Up Your Nutrition leader call in June. Right now, the tentative date for that is June 22nd from 2 to 3, but we'll send out a doodle poll too to see if that works for all of you as well, whoever's interested in being trained. And then the goal is to hopefully have at least one class completed by this fall. And I know many of our folks were talking about rolling them out like in September, Falls Prevention Month. And I think, oops, let me see, I think I just had one more slide. Yeah, here's the information about that live virtual leader training. And again, Angie will send this out in email to y'all. And I feel like I had one other thing. Well, I guess I would love just to hear, or in the chat, if anyone thinks this might be of interest to them, because I saw you were writing in your goals for the next 3-year plan. This could really help complement your like Stepping On or other evidence-based classes. And what they found is that people who offered this as session 0 had a higher completion rate for their Stepping On classes than those who didn't offer it as a session 0. I'll stop talking now. Any questions?
We're having some things in the chat. Lisa says, so very interesting, Kenosha County ADRC is planning on focusing on falls this year. So that might be a nice compliment. And, you know, when we just had Carrie talking about SAMs, with this particular Ground Zero class, obviously it's not meant to be evidence-based because that's typically a longer program where you can see behavior change. A 1 session, 2.5 hour, it's difficult to show that, but it's a great feeder class. So you would be entering this under nutrition education. We want everyone to kind of put it all in one area in SAMS so we can see comprehensively what everyone's doing across the state.
Thank you for mentioning that, Angie. I knew there was something else I needed to mention. So if you record it under Nutrition Ed, there's a sub-service for Stepping Up Your Nutrition. And again, contact Carrie Kretz, our goddess of data management, and she'll help you get all of that there. And you can use your 3C pot of money, which is a big deal because a lot of you have a small D pot of money, but you have a much bigger C pot of money.
Yeah, and I think that's what we would prefer, just because you wouldn't be able to use your 3D money for this because it's not the evidence-based, but still, as I always say, still very important, even if it's not an evidence-based program, and not all are meant to be that way. So hopefully a lot of you will take advantage of this opportunity. I think it's a great way to segue into a lot of your classes.
Yeah, thank you. Thank you. And I want to give you a shout out and thank you, Angie, for letting me present this. And I know it's a really short timeline. We just found out about it, but I hope many of you can be part of that live training next week. And if you can't, no worries. We do have another option for you to be trained online. So just know there's 2 options, both free.
Yeah, but I'll be sending the email that Pam's talking about. I'll send that out right away since we know there's a really tight timeline. So I won't put that in the notes. I'll just refer to the email that was sent. So I will send that out yet this afternoon so you can just register right from the link.
Thank you. I'm sorry I have to pop off, but if you have any questions, just let Angie know or email me. I'm happy to help.
Thank you, Pam, so much.
Thank you. Thank you. Thank you. All right.
Okay.
Bye.
Bye. So I told you we had a tight, really packed agenda. We're just moving right along. But again, please feel free to use that chat feature and we'll make sure I can get those questions to Pam if I can't answer them. So our next program, Erin Eggert from WEHA and CARN is going to talk about the Stand Up and Move More program. So Erin, I will let you take it away.
All right, great. Thanks, everyone. I have the great misfortune of having a head cold on top of raging allergies right now, so please bear with me. But I'm here today to talk about a new program that we're bringing to WEHA called Stand Up and Move More. And this is a sedentary behavior reduction program developed over at CARN, or the Community Academic Aging Research Network, with Dr. Kelly Colton. So this kind of goes over through how CARN is the one or the organization that helps to develop new programs. And once they're developed, researched, and tested and shown to be effective, we hand them over to WEHA, who is the purveyor or distributor, just to distribute them across the state and the nation. And where we are with the stand-up program right now is right in the middle here. So we're doing what we call program translation, where we package the intervention and get it ready for broad dissemination. So when we talk about what sedentary behavior is, it is activities that do not substantially increase energy expenditure. So sitting activities like reading, watching TV, using a computer, eating, etc. Those activities that make up the majority of our day. So research shows that insufficient physical activity is a risk factor for chronic disease. But in addition to not getting enough exercise or physical activity, sedentary behavior is also a health risk. So people can be active, but if they're sitting too much, it's still bad. So long bouts of sitting are associated with cardiovascular disease, diabetes, cancers, and early death. And breaking up sedentary behavior has been associated with better health and function. So the Stand Up and Move More program is a 4-week program with a refresher session at week 8. And then for virtual programs, there is an additional session for session 0 as well. The program meets once per week and the sessions last about an hour and a half to 2 hours. And the program has been researched and tested in the in-person format. And as we're doing the program translation, we are also creating virtual and telephonic adaptations as well. Equipment needed are clickers, which range in price about $3 to $5 per participant, and then participant workbooks. Participants for the class, so you can have between 8 and 12 participants, and only one facilitator is needed. And the goal of the program is to reduce sedentary behavior or sitting time. Our target population for this program is individuals 55 and older who sit more than 6 hours per day. And then individuals must be able to stand on their own, and they should be able to speak and read English. The program includes information about the consequences of sedentary behavior, as well as the benefits of standing. It does some goal setting to get individuals to stand up more often and for longer durations. And then it works through identifying barriers and addressing those barriers, or problem solving to address those barriers. Strategies that we've seen used in the Stand Up and Move More program include standing while somebody is on the phone or every time they receive a call to stand up, standing during TV commercials or while doing chores such as ironing, and then while doing other activities such as knitting or puzzles. These are just some ideas that have been used. The program is evidence-based and has been shown to reduce sedentary behavior by 68 minutes per day, which is huge. That's a huge finding. And then in addition to that, there's also improvements in functional performance that includes balance, mobility, and standing up from a chair, pain interference, pain intensity, vitality, general health, and problems performing work or daily activity. So a lot of great outcomes from this program. To be a facilitator, you need to have experience leading groups of older adults and be comfortable tightly following a manual. And we do have a couple different facilitator trainings coming up. So we have one in August, the 11th and 12th. That one is full, but the waiting list is open at this point. And then we have one in September, the 14th and 15th. And then we are planning to have 2 early next spring dates, and dates are still to be determined. The facilitator trainings are all online at this point. So because we're in this program translation phase, we do also have a couple bonuses with if you are to be trained as a facilitator this early before the program is at the distribution level. Because we're still doing that final packaging. If you take an online facilitator training, at this point, the cost for that training will be only $100. So that price will go up after this phase. And then if you lead a workshop, or if you lead a workshop this fall, and then just for this fall, if you assist us with data collection, then WEHA will provide you with the clickers, so you won't have to buy the clickers yourself. And then just this fall, You will also get an additional stipend of up to $500 to thank you for your time and effort. So we're going to ask that you help us do a little bit with data collection. That will be like distributing and collecting handouts from the participants, just like surveys. And then as to thank you for that, then we'll help you or thank you with a $500 stipend. So that is just if you're being trained this fall. If you're doing the training in spring, February or March, the training fee will still be discounted to $100, but after that it will be increasing. So if you're interested, please contact me. My contact information is on the screen there, or you can always find more information about the program on our website as well. Questions?
Great. Thank you, Erin. Does anyone have any questions? You can either write them in the chat or just unmute quick and ask those to Erin. And because it is in the translation phase, it would not be considered a 3D high-level evidence-based program. So we have a subservice entered for Stand Up under 23B. So you could enter that data in 23B as in boy. So again, another wonderful opportunity. And I think after this pandemic, as people are starting to get up and moving more, but it's become an issue for a lot of people just not ever leaving their house. So this is just another wonderful program coming through CARN and WEHA. Questions, comments? No? Well, you know where to find Erin, so I will put her contact info. Oh, it looks like Jill may have something to add. Jill, go ahead.
Yeah, no, I didn't know, Erin. I'm sorry if I missed this, but did you mention anything about the telephone version, like the plans to have it available via telephone, virtually and in person? Okay.
Yep,
Thanks.
yep. So the program is in person, virtual, and telephonic. Yes.
Awesome.
Great, thank you so much. Okay, so I think we're gonna go back and I'm gonna share my screen again. A lot of screen hopping going on right now, but we will figure this out. Okay, so if I can see a thumbs up, if you can see my PowerPoint in the correct view. Okay, great, thank you. So this is just finishing up with Carrie. I just wanted to say a couple of things on the SAMs that I had when I was looking at the reports that I saw. I'm drawing some conclusions based on just some things I know for each aging unit, but I have a feeling when people were doing a program, I'll use the example of Boost Your Brain. If they just saw the word brain and they did any type of brain health class, they were putting that information in. So I think they're going into maybe sometimes the wrong categories. Another example is in 23B, exercise. So Strong Bodies is actually a high level evidence-based program. So you'd want to put that into the specific program. And I have developed a kind of a cheat sheet of all the different subservices available in 23A and 23B that have the descriptions, because I know a lot of times it's not the person that's facilitating the class that's entering the data, so there can be some things lost and maybe in transit. So I will be including that in the minutes. I also put all of this information out on our GWAR website under Technical Assistance Health Promotion. So you'll be able to look through that, and then hopefully that will help get the programs into the right categories. I also saw several that did not have any subservice indicated, especially with the high level evidence-based. You need to have that attached to a specific program. And Carrie and myself are always, here to help talk you through some of that. So hopefully that cheat sheet with the descriptions will be beneficial to help with that. So every year I give a report on our program summary for the year. And I have to say I was delaying doing this because I knew it was going to be a little bit sad for me. So we all know what happened last year, and it took a huge hit on our health promotion programs. And Jill Rankin from WEHA is going to be talking later about that as well. So if you just take a look at the evidence-based, and in particular, I'm talking about the high level evidence base, the 23A. Um, workshops that are eligible for 3D funding. So in 2019, we had 57,000 hours of workshops. And then in 2020, we had 19,000, which is to be completely expected. I think we're just going to put a big asterisk by 2020 when we report things because it's really hard to compare. And we still had over 1,500 participants in evidence-based programming. So we did have quite a few workshops that were happening prior to March, and then when everything got shut down, with the high level evidence based programming, there were very few programs that were researched to be online. So everyone had to pivot very quickly. And with the evidence based workshops, that's not super easy to do because you're trying to get pilot studies together and doing some research. So my hats goes off to WEHA for quickly pivoting most of their classes to be online, but definitely a challenge for us all. So looking at the top workshops that we had and comparing 2019 to 2020, similar workshops. So in 2019, Stepping On was our #1, followed by Strong Bodies, which is through UW Extension, Tai Chi, Healthy Living, and then Chronic Disease. In 2020, you can see Strong Bodies went to the top. They were able to pivot very quickly into a virtual format. Um, and also, I think another reason that was very successful is because that program, people tend to not just take the 11, 12 weeks class one time. They keep doing it over and over. So these groups of people had been together for a long period of time, and they had that social connectedness and that want to continue to see each other. So they were able to do that fairly quickly with the virtual program. And then Stepping On, which I think is amazing since, for most of the year, they weren't able to do it virtually. Most of those numbers came January, February, and then later this, towards the tail end. And I'll let Jill and the WEHA staff talk more about some of their programming. Another program that we saw jump onto the top 5 was the Mind Over Matter program. I know a lot of folks are having really great success with that program. And then Tai Chi was rounding out the top 5 workshops in 2020. So I'm going to pause right there to see if anyone has questions or comments or their experience. Was anyone surprised? No, I see a lot of heads shaking. No, not surprised. So one of the programs, and I know this is really small, but I'm really referring you to our GWAR website with this. So one of the programs that several of our aging units and ADRCs were able to take advantage of was the Aging Mastery Program. GWAR has a 3-year grant with NCOA, so we were able to give away starter kits, which several of the counties participated. In fact, we gave over 630 Aging Mastery starter kits out across the state of Wisconsin, just through our aging units and ADRCs, which is amazing. And some of those, instead of just giving out the starter kit, they also did a book club. So they invited those who received the starter kit to do a book club as part of that. And I'm going to talk about this pretty at length tomorrow on the Aging Forum call about the Aging Mastery Program and how we were able to quickly transition. So I won't go into a ton of detail on this, but we also have partnered with UW Extension. At the time that COVID came, I understand a lot of our staff at the aging units and ADRCs, in particular health promotion coordinators, were being asked to help fill vital roles such as transitioning their congregate to home delivered meals. So where before health promotion coordinators were implementing workshops, they were now being asked to deliver home delivered meals or to do other important tasks. So with the Aging Mastery Program, we were able to kind of coordinate with doing health promotion and also some grab and go meals. So they were giving the starter kits away with grab and go meals. But with our partnership with the extension, you know, they also have several, in most counties in the state, they have a lifespan educator. So part of their position is to educate older adults in their community. So we were able to partner with them. And they also partnered with several local aging units and ADRCs. In 2019, we had 12 10-session workshops. Just since January, we've had over 25 workshops through most of the state by just partnering together. So I have these listed just as some classes coming up, but the comprehensive list of classes, which I add to almost weekly, and they're mostly done virtual, so people can join from anywhere. We do have one in person in Door County that was taking place starting in April. But all of these programs you can refer folks into. And again, the complete listing I'll include in the notes, but we have several happening around the state. So I always get the question, how do I find what programs count for 3D funding? So we used to refer to a chart from NCOA. If people remember, it's about a 58 page document with all the different programs listed. And they just recently changed that. I do put this information in the GWAR newsletter that comes out every Tuesday afternoon. But I understand that some people may be on vacation and miss it. So they did change this to more of a search on their website. So they are no longer doing that chart that people referred to. I think it's important enough that I'm going to tackle this technology and try to show you this really short demo video. It's 4 minutes long, and it's going to take you to the NCOA's website and just talk through how you would find an evidence-based program, which is eligible for 3D funding in a variety of topic areas. So we're going to give this a try. And again, please use the chat while we're waiting to see if this works, or you can also hop off and talk. I've got my fingers crossed. How about all of you? Okay, here we go. It takes a few seconds.
Welcome to the National Council on Aging's Evidence-Based
Andy,
Program Search Tool
we
Demonstration.
cannot see a video.
Okay, what are
I
you
think-
seeing? Me?
We see your PowerPoint. I think you probably clicked to share the PowerPoint rather than the screen.
Okay, all right, I'm gonna stop sharing and then I'm gonna just share the, hold on. And believe it or not, I have practiced, hold on. I practiced this, trust me. Okay. Are you still there, everyone? Yep, okay.
Yep.
All right. Thank you for your patience, everyone. Feel free to talk amongst yourselves. All right, I'm going to try to share this now. 1 second. Okay, can you see it now, Erin?
Yes.
Okay. I know it takes a minute for the sound to come up.
Welcome to the National Council on Aging's Evidence-Based Program Search Tool demonstration.
Can you hear that, Erin?
Yes.
Okay, great.
The
Thank
search
you.
is housed on NCOA's website, which broadly features information for 4 audiences, including older adults, caregivers, professionals, and advocates. Today, we'll visit the section of the website for professionals and go to the Center for Healthy Aging. Here we'll find information about the center as well as the evidence-based program search tool. The search tool is a key resource for professionals in the fields of aging, public health, and others that are looking to learn more about evidence-based programs that offer proven ways to promote health and prevent disease among older adults. Use this tool to search for evidence-based programs that match your community's needs and are approved for funding through Older Americans Act, Title III-D, or Administration for Community Living discretionary grants. The programs included are not exhaustive and represent those that have been approved through the evidence-based program review process. Today, we'll talk about 2 ways to use the search. The first is to type the name of the program that you're looking for. As an example, today we'll search for Enhance Wellness. So we'll enter the name of the program, hit enter, and then we'll see one article shows up with more information about the program. Every program page has an overall description describing the program, information about the target audience, as well as health outcomes and key aspects of implementation that will help you decide whether this program is the right fit for your community. Once you're done reviewing the program, you can hit back to search in order to continue browsing. The other method for using the search is to use the filters provided. So you'll see that we start with a total of 70 search results. As we use the filters, the search will provide a smaller list of programs that meet the criteria that we selected. So as an example, I'm going to go ahead and say that we're looking for a group program that can be offered online and that talks about chronic conditions. And we'll apply the filters. We see that 20 options meet those criteria, so you could scroll through to see the list of programs that meet all 3 of the filters we selected. And you can go ahead and click on those articles in order to learn more about the program. If you decide you're looking for something else, you could go back to the filters on Select All, Apply, and then you'll see that you're back to having all 70 search options available to you. The last feature that I'll discuss are 5 pages we have that list all of the programs available on specific topics, including behavioral health, chronic disease self-management education, falls prevention, physical activity, and 1 page for advanced care planning, care transitions, and caregiver support. This is a good place to start if you're looking for quick information on what's available and are unsure of the characteristics that you're looking for. So here's an example of the evidence-based falls prevention program list, which includes all the programs that have outcomes related to falls prevention. So as you're combing through, if you see something that interests you, you could click on the program name, and that will bring you to the program description with more information. We hope you find this evidence-based search tool helpful. Best of luck as you look for evidence-based programs that are a good fit to serve older adults in your community. Be sure to browse resources in NCOA's Center for Healthy Aging to continue to support your work in implementing, expanding, and sustaining evidence-based programs.
Great. I just wanted to make sure everyone had the opportunity to know that that resource is out there. I should say that list too is not exhaustive. So if there's a program that's not on that list, Oops, sorry. Sorry about that. I think I just need to shut that down. Okay, great. So I think it's as I was saying before another webinar started, as I was saying, it's not an exhaustive list. So you'll notice that strong bodies is not on NCOA's list. And that's because every state has flexibility in what they approve as high-level evidence-based, and we do follow those 5 criteria. So basically in Wisconsin, any of the programs on NCOA's list in that search are eligible, but also we have others, for example, the WEHA programs, most that are to the point of where they're translated and they're being implemented. We give the okay before the national NCOA does. And that's for a couple of reasons. Sometimes the programs don't want to go national because if you're out on NCOA's website, then anyone in the country can start taking those programs and they may not have the resources to accommodate that. So those are some reasons for that. All right, I'm going to bring my PowerPoint back up. And Erin, are you seeing?
Not yet.
Okay. You don't see anything?
No.
Okay. I think the issue is I may have too many things open at this point. Okay. Okay, it says I'm sharing my screen, Erin, but it's not.
We can see the PowerPoint, just not in presenter mode.
Okay, that's a start. That's good.
Yep.
Okay, you should be able to see it.
We now see it in presenter mode, so we see your notes.
Okay.
Perfect.
Okay, thank you all. Here we go. Okay, does anyone have any questions on NCOA's website? I will put that link too, so you can go out and just navigate through and see if you see anything that looks interesting. And, you know, if you want to do a program that's not currently in our subservice in SAMS, but it's out on NCOA's website, we can absolutely put that into SAMS. A couple of examples in 2020, we had 2 brand new programs to the state of Wisconsin. Bingo Size was one that we added to the high-level evidence-based subservice. And then Eat Smart, Move More, Weigh Less was also added to our 23A. And again, you'll see that whole listing with descriptions in the new cheat sheet that I made that I'll be sending out. The other item that I wanted to talk briefly about, and I know a lot on the call are aging unit directors, but we also have some health promotion coordinators and other nutrition staff. And the directors are attending meetings for aging plan timeline development and developing their 3-year plan. I wanted to bring it up at this meeting because everyone, all counties will be writing a health promotion goal. So I wanted to give you a couple examples and also show you a timeline of when all of this is going to be turned into GWAR. So this is the timeline right here. You can see we're slowly moving along on that timeline. We're in the May to July. So starting in January, your aging unit was collecting some information, some surveys were done, some focus groups, and I've really been amazed at the amount of outreach and creativity that has happened from our aging unit. So the whole point with the aging unit plan is that you're getting input from older adults in your community and you're listening and responding to those needs. So gathering, hopefully that's already taken place or just slowly starting to end. And at this point, you're looking at drafting some goals. In particular, with this meeting, I'm referring to health promotion goals. And if you can see the whole timeline, it's all going to be turned in by the beginning of November. So there's going to be some drafts, and I'm more than happy to review your health promotion goal if you want to brainstorm or to come up with some other ideas. So um, we're doing the goals a little bit different this year, trying to get more of a holistic approach. So looking long term at 3-year goals and doing action steps or strategies along the way. GWAR has created a few different materials to help you along with that process. One is a goal worksheet, and that's basically just getting all the information you can and gathering it into an organized way. So we have a worksheet to help with that. That's, however, completely optional. That does not have to be turned in. It's just a great thing to get you thinking on different strategies and activities. What will be turned in is a goal template, and I will be showing you that. And I've developed a few sample goals that are available out on GWAR's website under Aging Plan Resources, so you can go check those. I will be creating more as well. So these are the questions that are on the goal development worksheet. What are you trying to improve, or what problem in your community are you trying to solve? And here we're thinking of health promotion and disease prevention. What's the current status? Is it getting better or worse? Is there anything standing in your way or hindering your process? And what factors are supporting your efforts? Possibly different partners, which you'll need to help you succeed. Some strategies or steps that could help. And what do you see as your ultimate outcome or result? And of course, along the way, how you're going to measure your progress. So this is an example of what the goal template looks like. And I just kind of filled in a few things. And you can certainly use these goals and put in information specifically to your aging unit or ADRC. So this goal that I created an example of is reduce the health effects of social isolation and loneliness by detecting older adults who are most vulnerable, implementing evidence-based interventions, and evaluating outcomes. So we all have heard a lot about social isolation and loneliness, and we know that health promotion programs help create those meaningful connections, which thus can reduce the health effects. So I didn't fill in all the blanks on this because I was hoping people could write in the chat and come up with some ideas, although I do have a completed goal sheet template for this social isolation and loneliness out on the website. So just to give you an idea of how this works, some specific strategies and steps to meet your goal. So one strategy is to make sure people know that it's a problem, that raise public awareness, help people identify possibly older adults who may be lonely or themselves as being lonely. We also have a social isolation and loneliness coalition that has been started at the state level. So you could as part of an action step with raising public awareness is participate. I know we have a public awareness work group off of this larger coalition, and basically they're looking for different counties, aging units, ADRCs to review some of their materials that they're creating to see if they resonate with older adults. So just by participating, that could be an action step. Distributing some materials that have been created. Another strategy would be to detect and provide access to culturally relevant resources and interventions. And this would go to the health equity, to providing health promotion to groups that typically may be underserved or have not historically participated in activities, and how do you reach them? Another strategy is implement and evaluate interventions to improve meaningful connections. So there, you could add in the evidence-based health promotion programs by promoting and increasing attendance at the workshops. And then to measure those, there's different ways to do that, and I won't go into each specific one, but my idea here is that I just wanted to make sure everyone was aware that you will be creating a health promotion goal. There's lots of different ways you can do this. And instead of in years past, you would put maybe for year one, I will do 3 health promotion programs. Here, we're really looking at what do we want the outcome to be and what can we do along the way over the course of a longer time period to see more behavior change and more results instead of just reporting out that, yes, you completed 3 programs, which is very important, but that's really just an action step to get to your ultimate goal. So I just wanted to provide you with some examples. There's another example on fall prevention that is out on GOR's website, and I'll be creating one on health equity as well. So feel free to use those. And again, I'm happy to work with people one-on-one to talk through some of your health promotion goals. Does anyone have questions or comments on the 3-year aging unit plan? Is everyone already done with those? I see some people laughing. No. Well, hopefully this helps, and you know, you don't have to create things from scratch. Feel free to look at the ones I've created, and if you have other ideas, I'd be happy to work with you on creating a template so others can use that as well. Do you see anything in chat, Erin?
No, I don't.
Okay. Please feel free to reach out to me individually as well. Okay, at this point, I'll turn it over to Weha. Chris, were you going to talk? Because I can give you co-host, but if you have anything to share.
I won't. I think, we've talked about the Healthy Aging Summit, I think a couple of times now on this call. So I will maybe just put into the chat the link to the summit webpage. I see lots of you on here that are already registered for the summit, so we're really happy to see that. The event is coming up. It's about 2 weeks away now, so we're very excitedly making our last minute putting together our program and really working on spiffing it up to make this a fun and interesting event for you. So we encourage those of you who haven't registered yet, but are interested to visit our webpage. Again, that's in the chat. And take a look at all we have going on. We have Louise Aronson coming, Dr. Louise Aronson. I know I've talked about her in the past. She's written this phenomenal book called Elderhood, and she's going to talk about the sort of the way we think about growing older. And I know this has been a theme that we've talked about in the past too at the summit around ageism. So she's phenomenal. She's done a lot of national speaking. So we have a great lineup again for you. I see Lisa's asking, what's the deadline to register? June 1st. With like all the registrations in by June 1st. We've had what I think is a really pretty great. We weren't sure how this was going to go, frankly, this year, given that we're doing this as an online event, which is a little different for us, but it's been a really great response. Those of you who are on the call here are all, I believe, program providers of WeHUS. So one program or another. So you are eligible for a discount. So if you go to the registration link on our webpage, can't miss it, go to WI Healthy Aging or follow the link that I sent you there. Go to the registration link. And if you put the code RPP2021, you're eligible for a discount. It's currently, oh, thanks, Jill threw it in there. It's currently $169 for the full event, but you would get a discounted rate of $129. So we're, again, excited to be welcoming you all to the event. Those of you who have registered, we encourage you to dig out your confirmation email and go online and check out the summit agenda, and it'll give you an opportunity to move some of those things from the agenda onto your own personal calendar. So you'll be able to, when the day comes, click on that and go right to the Zoom link that'll take you to those sessions. There is also on our webpage, Erin, who, if you haven't guessed already, is our tech expert at WeHA, created a video that will help walk you through how to go through and create your own personal agenda for the event. Because we have 3 flights of workshops, and you have options, of course, in there. So you can select and put that on your calendar. And then when summit day arrives, you will have access right from your calendar to the Zoom session. If you have questions, you can absolutely contact me and we'll walk you through anything that's challenging. Cami asked, can you get the discount if you've already registered? Yes, you can. Cami, I'll email you after this. So sure, you bet you can.
Kristen, I'll just add in too that you can use your 3D dollars for registration. It just cannot exceed 25% of your overall Title 3D allotment. Because we do need to see that there is client data in SAMS. So if you spend all your 3D dollars sending your entire staff to the Healthy Aging Summit, we'd love it. But then you wouldn't have any workshops implemented, more than likely, to show in the client data, because we want to balance SAMS and fiscal. So you can find out if you need language to give to your fiscal staff with that. There is a Title 3D FAQ out on GWAR's website, which goes into detail, and I will also send that out in the notes.
Great. Yeah, thanks, Angie. That's a great point. You can use those resources. Other questions?
Looks like in the chat box, what's the deadline to register? Is there a registration deadline?
Oh, there is. Yeah, it's June 1st. Mm-hmm.
Thanks.
And that's also on the webpage. So you'll see the deadline there, but you won't be able to find the RPP 2021 code there. That's just for you. So keep it under your hat. All right. Well, we hope to see lots of you there. Again, we've got a nice group already registered, so that feels like a win to us, and we're really excited to be bringing this this content and these exciting, inspiring speakers that we have lined up for you.
Thanks, Chris. All right, Angie, is it okay if I share my screen to talk about data collection, or I don't have to?
Yep,
okay.
No, that's fine. I'm going to stop sharing mine.
All right, so good afternoon, everybody. Good to see everyone. I am going to just go through a little review for those of you who fill out workshop notification forms and do data collection for the WeHA programs. We're just seeing a couple questions come in. As you know, everything is different with doing virtual programming with data collection. So for those of you who have been doing it, we've seen a couple questions in regards to participant data. And what we're recommending is that if you are doing virtual programming, this should all be in a very lengthy email that you get from our administrative team. But if you are doing those virtual programs for participant data, we want to make sure that all your participants are getting their data in, which isn't really happening, which is kind of understandable because they're probably getting quite a few emails and inundated with things, and they're just focused on getting onto the workshop. So what we're recommending is that if you can hold a session 0 for your classes, or talk with your people before they're in that orientation session before they're joining the virtual programs, if you could make sure that they're filling out the data collection, that pre-survey before session 1 starts, that would be great. Some people have said it's worked really well to type in the link into the chat box on Zoom and give everyone 10 minutes to quick fill that out as you're doing that orientation session. That's one thing that's worked. And then of course, individually with people as well. So we're just encouraging you to do that kind of all in one clump instead of trying to figure it out as the class is getting started at session 1. So all of that data comes directly to WeHa. It goes directly into our secure database. It is a little difficult for us to get emails and people asking, oh, did this participant fill out the form or not? Pretty difficult for us to be able to look that up. We can do it if needed, but if you could maybe keep track on your attendance log, whether or not people are filling that out, that would be super helpful. We would appreciate that. And then I just wanted to I'm going to share my screen and show you a quick reminder. We just started, we just sent out the Registered Program Provider 2020 report. So what that is for any organization that did a workshop in 2020, whether it was in person or virtual or whatever, telephone, whatever it was, you should have gotten a report, and it'll list out the overall statewide numbers, and then what you did, what you were involved in as an organization. Know that so many of you are coordinators for your county. Know that any organization that's a registered program provider that was involved in that workshop is going to get a report. So for example, if you are the coordinating agency for any of the programs and you have multiple partners involved, so you have leaders from other organizations that were involved in workshops, they're also going to get the report and their own report and have those numbers on there. So every organization that is involved in a workshop will essentially get credit for that workshop. We've been getting a couple questions, and this happened last year too, and we know this is a fairly new system that we have at WeHa. But in order for an organization to get credit for that, we just need to make sure that the workshop notification forms are filled out correctly. So I'm just going to go quickly through this just to kind of give you a reminder overview. When you are filling out a workshop notification form, and I'm just going to do it right here so you can see my screen. This is just an example from the Living Well one, but it applies to all of them. When you go down and you're obviously clicking on the type of workshop, whether it's in person, online, or phone, you're going to type in here the leader information and then their registered program provider organization. So that is their organization. So if it's from Marshfield, if the leader is from Marshfield Clinic, then you would type in Marshfield Clinic. And then the leader number 2, the same thing for leader number 2. Then when you go down here to the primary registered program provider, this is likely you. It's different, obviously, in every county and tribe, but this is where you're going to enter in your information. So if you, as the Aging Unit ADRC, are doing the primary coordinating of the workshop, you would type in your information here. So I'm just so essentially there can be 3 different organizations involved in one workshop, depending on where the leaders are coming from and who's doing the organization of the workshop. So I know we've gotten a few questions from some of our leaders saying, oh, we didn't get credit for any of the workshop. And it's usually what happens is sometimes we're seeing that under the leader 1 or 2, the ADRC will be written down, even if they're from, let's say, the public health department. So that's why I just wanted a quick overview that for anyone who hasn't been filling these out very much, just to kind of go over that. Does anybody have any questions on that? We just want to make sure that everyone is getting credit where needed for each workshop. Okay, no questions on that. I appreciate it. I know that's sometimes not the most exciting thing to have to remind people about, but it really, really helps with those year-end reports, and it helps us know who is active and who is not active in the state. So thank you so much. All right, so next up, we just have general overall updates. Oh, sorry, look, I guess there is a question. What do you put in that box if the leader is not with an organization and just volunteering? Okay, so thank you, that's a great question. So if they're just volunteering for your organization, then you would just put your organization there. So it could essentially be, the ADRC could be the registered program provider for all three of those sections if the leaders are your leaders. Yep. And in volunteering, meaning like they're not getting paid from their employer to do the workshop. Yeah. Okay. All right. So general overall program reports. Overall, we're seeing some great uptake with the virtual programming and telephone programming, and we're seeing also people going back to in-person workshops. So Erin can speak to it more, but we have updated the safety, the COVID in-person safety protocol. I know that many of you received an email from me last week with that attached. We do know that the CDC changed the guidelines just recently, a few days ago. So we are in the process of reviewing that and making sure we don't have to change it again, but we might be. So just stay tuned that those guidelines that I sent out last week may be updated with the new CDC recommendations. So that will be happening very soon. Oh yes, and Angie said too, the guidelines are going to be in the GWAR Digest today. So that was from last week. There may be an update coming soon. Erin, did you want to say anything more about that?
I don't have anything to say yet. We don't know anything, but we're working on it.
Yeah, we will keep you updated as soon as we know. Our chief medical officer is reviewing it, and we're making sure that everything is solid and safe for you all to be doing that. So we encourage you to follow your local guidelines with in-person workshops, and it's exciting to see that they're happening again. So also know that the online programs are here to stay. The telephone versions of the programs are here to stay as far as we are aware too. I know last year we were like, oh, you know, let's just do these for a little while. Well, they're here to stay as long, and also with that is the leader trainings. We've been doing online leader trainings, and that's one blessing that we've had this year too. A little bit of a silver lining is that we've converted everything to online leader trainings. What we're hearing is that people are really enjoying the online leader trainings. They don't have to travel, the leaders don't have to travel, and they can just join from the comfort of their own home. So if that's not the case, and you have leaders who prefer in-person leader trainings, please let us know, because right now we're operating under the assumption that most people are actually preferring the online ones. So please let us know. Like I said, we still will have some in-person trainings available depending on what the program is, but please keep us updated if you have needs that are not being met with the current offerings for trainings. A couple quick updates on program content. The Tomando program, which is the Spanish version of Living Well, will be updated in the next couple months. So that's coming soon, as well as the Healthy Living with Chronic Pain curriculum. That is going to be updated and available later this summer. So stay tuned for that. What the updates will likely be just a few hours online. Cost is looking for the chronic pain update will probably be around $135 is what we did for the Living Well training last year. So it'll probably be similar to that. If anybody has issues with that or needs scholarships, let me know. Also, with that chronic pain update, we will likely not be holding a brand new chronic pain leader training this year. We just finished, actually, we're finishing our last session tomorrow for the one that we're currently doing now. We won't have another one because of the update. But if you have a deep need to train somebody in chronic pain this year, I think Heidi, I heard her say earlier that she wanted to get people trained this year. If you do, please let me know and or fill out the waiting list online. So if there is a huge demand for it, we can make that work. But right now, we're just going to focus on the updates. Looks like Erin has some updates here in the chat box. That Stepping On leader trainings, we do have some in-person ones happening in July and September, and then a virtual one, Mind Over Matter. Also updates in the chat box too. Looks like a question, is the leader training schedule on the WeHire website up to date? Yes, it is. So please check that. I know this year is a little different because usually we send out the schedule and it happens at the beginning of the year, and that's the whole year. That's basically there to stay. This year we're adding and changing things all the time because we didn't know what was going to be available for in-person trainings as far as locations and all of those complications. So they are always updated. Please check the WeHire website. Erin put it in the chat box. Thank you very much. We're, like I said, we're adding programs. I know we're going to add a Living Well for the fall. We have a Healthy Living with Diabetes one coming up in July. So those will be the only trainings offered for Living Well and Healthy Living with Diabetes for the rest of the year. So if you're interested, sign up now. Let's see, other major things that I wanted to go through. I know it's 2:30, so I just wanted to remind everybody that we do have the telephone versions available also for the chronic disease self-management programs. We aren't seeing a whole lot of uptake in the telephone versions. So if anybody has any feedback for me as to why those aren't useful, please let me know. Wanting to make sure that we're addressing whatever needs are out there for all of our program providers. All right, that's all I have. It's 2:30, so I will be quiet and hand it back over to Angie.
Great, thank you, Jill. Okay, so our next health promotion webinar is August 17th from 1 to 2:30. And Jill and I had several polls to do, but but time got away from us. But I did want to just launch one quick one as a final, just to get your feedback on the webinar, how often you would like these, if you'd like them more often, less often. That would just be really helpful for me to know. And then this is a picture of my coworker, Bella, who's usually sleeping behind me. And I'm sure we all have a lot of furry coworkers lately, but so we'll just give it a few seconds. So it looks like they will continue quarterly, which I understand because WeHire also does summer school hours, office hours, where they talk about some of these specific things as well. So I encourage you to go to those whenever possible, but I'm always available via email or telephone call, happy to help and provide any technical assistance you may need. So with that, I will see you all in August, and I appreciate your time this afternoon.
Thanks, Angie. Thanks, everyone.
Thank you.